these hours take me a deep impression and raised my enthusiasm regarding research, even this translation medicine, as 10 or 15 years ago, translation medicine, the meaning was a little bit others. So translation medicine 15 years ago was the concept, or 10 years ago, that you need to do some basic research, and how basic research will be so experimental and such things, and how this became a clinical useful treatment or something like this. Nowadays, translation medicine is rather how we can understand our daily activity and to select and refine the refine our daily diagnostic work and therapies. And so today, as I experienced your great efforts and skills and development in the last years, or in these 2 years, I believe that these efforts are not useless. So I want to reinforce you that even a small pieces what we can do for our patients is a very high value. So this is a value of diamonds. And so I thank you not just for the candidates, but for our committee. Thank you for your work and thoughts, very personal thoughts sometimes. So this, I believe that this day was not just a boulder to jump over successfully, but also reinforced you that you need in the future also put even more efforts and knowledge to increase the quality of the care of our patients. So thank you again for all of you. And now I will, no, Mahmoud, please announce those people who were the most active today.
Yes, so as promised in the morning, those who asked 3 clinical questions during the day, they will get a certificate of excellent questionnaire and a bottle of wine. So I'm glad that we have 3 winners for today. So I kindly ask Zihan Su to come to the stage. Congratulations. And the certificate as well. And Adam Vince. No need for this?
Yeah, of course.
And Bigom Kep.
So thank you very much everyone for being here and spending the day with us in the cardio-intensive group's complex exam. As you could see, we are a group of very different people coming from very different domains, very different fields. Some of us are young residents, some of us are experienced specialists, some of us are medical physicians, some of us are not. But we're all united with one vision and mission, which is that we would like to make life better for our patients. And we believe that clinical research and literacy in clinical science is going to help us build up our healthcare institutions and our patient care protocols. And this was only a small slice of the whole cake which is cardio-intensive clinical medicine. I wish all of my students and my colleagues continuous success, and I'm sure that everybody here who has presented their projects have achieved a level of literacy and competency in clinical research of which the fruits we will see in the coming years and decades. And I cannot wait to work with you all in the future. And finally, I would like to thank our board, the esteemed chairs, for being here and contributing to the success of these students. Your presence and your attendance and your attention for our students is invaluable. I really hope that you were satisfied with what you have seen as the results of a year and a half of Center for Translational Medicine Systems Education. So a big round of applause for all of the students who had the courage to come here and present their projects today. So as always, it's not only the presentation and presentation of the results, but also the scientific thinking, communication, and discussion skills. So that's why, as is our tradition, we reward those students who actively participated and asked excellent questions, challenged the presenters, and broadened our horizons. So I would like to call 4 of my colleagues here to receive a certificate proving that they are excellent questionnaires. And first I would like to ask Anna Bartolozzi to come on the stage. Next is Iona Irena Rezuš. Timeja Matjaž Dombit. And finally, Petros Uvojnoš. For this, you get 2 bottles. Thank you so much, everyone, and I would like to invite everyone to a reception with wine and cheese for networking. Thank you.
I would like to thank Professor Beck for his visit and active participation and the excellent lecture, which we learned a lot from, and also raised the quality of the board. Thank you very much. So my role to announce whether you have passed or not. Now, this is, I know, this is a stressful moment now. So let me list the name who passed and who not. So anyway, we have, on the complex exam, we have just 2 options, pass or not pass. So I can tell that the board was very satisfied, and we congratulate all of you. You obviously passed, so congratulations. I also thank Professor Hegyi and Professor Varga for leading this group, and also for this whole project, which is very efficient as far as the dentistry group I can talk. So thank you very much, and definitely I can tell that the faculty will support you in these studies and expect your contribution to our scientific results as a faculty in the future as well. And thank you very much. Again, Alex, a lot of thanks for doing this.
Thank you very much, Professor, for your words. Also, once again, thank you very much from our side, from the Center for Translational Medicine, to everyone who has been here today for this really engaging and very, very thought-provoking, interesting session today. But also a special thank you, of course, to our really outstanding committee today, our international guests, the deans, and other further committee members. Thank you very much. Let us thank them in the usual way. As you have heard in the beginning of today, there is also something more to celebrate and to thank. So further than the thanks to the committee, I would like to thank the really excellent participation today. And we have in total 8 excellent questioners who had much more than 3 questions. If there would be the possibility for more wine, I think we wouldn't even have that much. So I would like to ask you one by one to come up, and you will receive the Excellent Questioner Award as well as a bottle of wine. So as a first for today, I would like to ask Flora on stage. Perfect. Thank you, Flora. As next, I think also way more than 3 questions, I would like to ask David on stage. Yes. Daniel. Well, super. Thank you very much, Daniel. All right. As the next excellent question, I will need to say, Adel, please join us on stage. There are a few more, so not to be forgotten, Adrian Pall, please join us on stage. Thank you very much for your participation. Further, I would also like to ask Bruna on stage. Thank you very much for your really active and vivid participation today. Amazing job. Further, I think there is a pattern to be seen here, right? Most of the questions were asked from this side, so maybe tomorrow this side will be more active, but let's see. So, next I would like to ask Lillian on stage. Thank you very much for your participation. Further, oh, actually we have one from this side. Yassir, please join us. Thank you very much for your activity. And the last one for today, but also of course everyone else who had at least one question was great, but as you know, you need 3 questions to get the bottle of wine and the certificate. I would like to ask Jofi on stage. So I think with this we can conclude a really, I think in my eyes, an amazing dentistry complex exam day. For me, I think best so far, I really need to say. Also, thanks to the really active participation and again, the committee. As you know, this is not the end of today. We invite you all very warmly and heartful to come to the next room and to join us for some cheese and wine tasting. Thank you very much for being here. Thank you very much, all of you.
Actually, I think we could say on behalf of the committee that we're very much impressed with the presentation of the people, and I would like to congratulate everyone involved, not just the students, the mentors, statisticians, SMSs, and everyone who I haven't listed in this. They did a fantastic job, I think, and it's nice to see that you've progressed so well and have submitted publications to very good journals, and people already have accepted papers in very good journals, which is always nice. So I wish that you will keep up the work. Overall, I would also like to say that some people would probably need to make use of their time a bit better overall. So you have 10 minutes, make use of this 10 minutes. And don't overdo it, of course, but if you have like 2 or 3 minutes left out of the 10, then you probably didn't rehearse the presentation well enough, because that will make the feeling of being rushed. So if you don't show us slides for particular amount of time and we can't really see what's on the slide, that makes us frustrated. So obviously that will show up in the report evaluation as well. So the rule of thumb is that we've agreed with Marcus during the lunch break is that you should have about 1 slide per minute, which means that that would make up like a 10 slide presentation for a 10-minute presentation, and some people had like extremely huge number of slides, which again makes things really difficult to follow. But I'm pretty sure, I mean, you are at the beginning of your journey, so you can learn from these evaluation, and I hope you do get the scores that we've individually assessed. But I think just speaking to colleagues, we were pretty much on the same page with respect to that. Again, everyone passed, so both the written and the oral exam. So keep up the good work, and maybe see you doing some progress reports, and even maybe at the PhD defense as well. Thank you very much.
Yeah. Congratulate the students and our esteemed committee for facilitating the discussion for today's gastroenterology complex exam. And I would also thank the SMSs, the statisticians, the supervisors, the event organizers. Without them, that wouldn't be possible. And as promised in the morning, so we have a lot of excellent questionnaires. So I would like to congratulate these students as well for the active participation during today. And those who asked 3 clinical questions during the day, we promise to give a certificate of excellent questionnaire, supplemented with a bottle of wine. So I would like to call the names to come to the stage. First, I would like to call Madalena Andrea Belde. Congratulations. Maria Bukur. Yasmin Nemeth. And from our first year students as well, Tamás Tolgyes, Gergely Kollány, Victoria Barna, Lutza Havelda, Zsófia Román, and last but not least, Amir Macaulay. Thank you, Amir, for the assistance. Yeah, you got yourself one. We take a group photo for the excellent questionnaires.